Hello, I am very pleased to be among you today. We are in the ASCO-GOIS International Webinars. ASCO is American Society of Clinical Oncology. GOIS is Global Oncology Implementing Science Program. It's a part of GOU. This program is entitled Be Game Changers in Global Oncology. And it's really, the change is very needed. The focus of the 3 webinars is on how, via scientific approaches, to lower the total cost of systemic therapy without compromising the outcome on patients. And this is, again, this is the whole, maybe, core of the win-win initiative. But not only for systemic therapy, but for cancer care in general and cancer control. Title of the third webinar, an overview on scientific resource saving and better value cancer treatment approaches. The title of the 4th and 5th webinar will be the upcoming webinars. Next month, it will be examples of scientific exploration for research saving better value cancer drugs or systemic therapy. I know that the 4th and 5th webinar will be enjoyable because there are many pharmacology, many examples of clinical work, and many publication about this. But this third webinar is very important because it is it shows this. If we would like really to be game changers in global oncology, we should be aware of in critical view, also in constructive critical view, most of the ongoing initiative, and englobe all together. And we be very open to any initiative that serve the goal. As we say always, the win-win belongs to all. It belongs to you, and will be it is win-win. An overview on scientific resource saving and better value cancer treatment approaches by Professor Ahmed Elzawawy, Chair of Win-Win Initiative, Chair Board of Directors of Global Oncology University, the GOU, and founder, President of ICDOC, Experts in Cancer Without Borders, and past President of Aortic African Organization for Research and Training in Cancer, Professor of Clinical Oncology at Canada University, Ismailia, and Chairman of Al Suleiman Radiation Oncology, Port Said, Egypt. But this based on chapter 14 that and we have the links of everything of the full program, and we are stimulating brainstorming issue. We don't claim that we have the completely perfect statement or complete truth. Science is perpetual searching forever. So leave recorded panels or organized, including this webinar, as part of this program. They are open for all views. This could enrich science and the cause of cancer care. All your feedback, comments, and suggestions and constructive critics are welcome. This disclosure of interest, none. And I would like to say that if I say this communication is by me, but presented by me, but I inspired from the work with distinguished colleagues. It's not inspired, really. International organization, and my work in many international organizations and society in the world, in committees as advisor, expert, and chair for along the last 35 years. You notice that most of our slides as the text is not short, not with few words or slides, because what present is summary, but as much as possible we add some reference is intentionally to be used as PDF material or for all who would like to receive the copy. So the full text of the slides is between you and us. If you can ask for it, we can send it to you. As we agree together in the Win-Win Initiative, we adopt this flexibility of thought, free flow, idea, classic and innovative approach. The objective in this third ASCO-GOIS International Webinar, we present example of prominent initiatives, but there are many initiatives in the world. The Win-Win International Initiative, the total cost and not solely the prices of, we stress on that, and not only the price of drugs or devices or intervention. Personalized cancer medicine and better value outcome on patients, using wisely campaign, Financial Toxicity Tumor Board, Common Sense Oncology is very important. Also, and Bishal presented that in our GOIS program, a nice communication about common sense oncology, which is very important in the last webinar. Encouraging probable futuristic approach, reducing the cost of care via a redesign of health. Reminder that the two wings of the Win-Win international scientific initiative are to increase affordability of better value cancer care in the world via scientific approach, education, studies. That is why we are doing what is the things, education, studies, and research, and win-win models that consider the interest of all stakeholders. All will win. Second thing is to increase the number of quality of cancer services in the world via catalyst action. We don't claim that we do all. No, catalyst action and relevant collaboration, cooperation always, and relevant education and training. The goal on how to enhance human capacity and resources, and said adopt adopt and lead scientific approach to increase affordability of triple value cancer care. What is triple value cancer care? The patients, the community, and science. For millions of cancer patients in the world with dignity, and not just the usual ready-made program stereotype repeated curriculum. And the global oncology implementing science, part of GoU. The Win-Win movement introduced modestly by me in December 2007, but I don't claim that I am the inventor. This is after inspiring and consultation with many experts and stakeholders and even industry in the world. We don't seek for praise, but the glory is for the real doers, and particularly the locals everywhere in the world. In the real world, why it is win-win? Because the interest and the sensitive all stakeholders should be considered to be realistic incentive and remuneration of professional cancer care are mandatory, should be considered as and repaired. Otherwise, the different ways of corruption under different name or abuse of resources or commission or percentage or whatever, it happens in most countries, even my country, surely, in different parts of the world. Will continue. It will continue if we could not consider well the cancer care professional as one important element of all this initiative. All will win. It is not unrealistic or romantic, but it needs smart and innovative scientific focused approaches and broad scope and intelligent deals. Even the industries will flourish more, because otherwise it will be not realistic and enormously increase their markets. Many markets will be open, could be open. There are many dead market or weak market. There is need to change the game of global cancer care, and for a think tank that like what proposed by President Roosevelt for the New Deal. We have a component here. We start with a win-win initiative, as we give you a hint about it, but you know many about it. The win-win initiative suggests the clinical oncology shouldn't copy protocols or guidelines of international societies or group automatically. They don't feel fit the local patient and condition. For example, by definition, the cancer treatment guideline could be very useful as guides, but not obligatory considered as pathways to treat certain patient in front of you, which is maybe different from the next patient in front of you. And this means that there is wide gate for scientific works and relevant publication for the real world practice. We mean the total cost and not solely price of drugs or device per se. However, in the last year, there is more skyrocketing increased prices of new drugs than ever. We in the win-win in movement stress on that the value of intervention and treatment should be patient-centered and also varies at different communities and conditions. We stress on that the win-win movement we mean by scientific study, not only medical, but clinical, pharmacological, medical physics, innovation in health industry, and informatics studies. And also economic research, business model studies is very, very important. And all aspects that contribute to increase access to better value cancer care in the world. In the win-win movement, we adopt the notion that inspiring from measures or experience of some countries could be useful in other, even from rich country to poor country or the contrary, provided from poor country to rich country. Yes, it's possible, provided it should be applied in a smart and scientific way to adopt or modify only or to modify only the measures that could fit the specific countries. Personalized cancer medicine and better value patient in 2011. I presented that there should be a broader measuring term of personalized medicine, proposed that the term personalized treatment would dispatch from the notion of only hitting one target on the tumor by a drug, usually expensive, to the broader concept to consider medical factor, biological factor, which is very important, but should be effective. By condition, it could be quite effective. And human factor as personal expectation and priorities without compromising the overall outcome via evidence-based studies. I present also in a book, Better Value Cancer Care, led by Professor David Kerr and Professor Moore Gray, and also Professor Eduardo Garza hold decision. I participated and presented in ESMO 2014. It should include prediction of risk and toxicity of treatment in the real daily practice in the real world. This is also we add. Choosing wisely in medical practice is very important initiative. Over-treatment and unnecessary care and the consequences for patient safety and health system and sustainability are issue of increasing concern. The Choosing Wisely campaign became international multidisciplinary initiative. More than 80 professional studies, societies, and even increased now, have participated in the effort, generating a list of more than 800 examples of unnecessary and low-value service, and is increasing. The win-win movement comment, our comment that it's great appreciation for the huge international work of the Choosing Wisely and collaboration, but there are limitations. We should explore all. Choosing wisely medical practice over the cost of cancer care is augmenting exponentially. It become now 173 billions in 22, and now it's more in 2025. And 21% at least of this cost is money spent is unnecessary according to publications. You can view the web Choosing Wisely. This is their web, and there are many examples led really by Professor the great professor that I appreciate very much, Professor Lewel Schneiber, United States. American Society of Clinical Oncology declares the Choosing Wisely top 5 list. However, ASCO also stated that the items are provided solely for informational purposes and not intended to replace a medical professional independent judgment or a substitute for consultation with a medical professional. It's very important. For example, don't use a combination chemotherapy, multiple drugs instead of chemotherapy with one drug when treating the individual, instead of chemotherapy with one drug when treating an individual for metastatic breast cancer, unless the patient needs a rapid response to relieve tumor or related symptoms. This is a condition. Avoid using PET-CT scanning as a part of routine follow-up, many frequent for PET-CT, to monitor the cancer recurrence of asymptomatic patients who have finished initial treatment to eliminate the cancer unless there is a high level of evidence that such imaging will change the outcome. This happens everywhere, unfortunately, even in my country. Many don't perform PSA testing for prostate cancer screening in men with no symptoms of the disease when they are expected to live less than 10 years. Don't use targeted therapy intended to use against genetic aberration unless the patient tumor cells have a specific biomarker that predict an effective response, quite effective response to targeted therapy. Recognize limitation. This is a very great noble initiative, but there are some limitations as anything in the world. No doubt there is a great need for all over the world to achieve the aim of choosing wisely. But however, the campaign has garnered both praise and critics, constructive critics, and some of the ideas have spread to other countries. In a study done in 2015 in USA, primary health caregiver found most choosing wisely recommendations easy to follow, but they feel that some, especially those for symptomatic condition, would be difficult to patient to accept. Some doctors said that they lack time for the recommended discussions, and sometimes it's not so easy. Mostly not so easy. In UK, English doctors are worried how patients will perceive the initiative. Choosing wisely recommendation should not be used to establish a coverage decision or exclusions. This is according to ASCO. And ASCO said that it is, but they meant to encourage conversations about what appropriate and necessary treatment, as each patient's situation is unique, is according to ASCO, and this is reference here. Regarding the impact, one should note regarding the impact, one of the noted critics is that choosing wisely does not include evaluation of the effect on cost or discussion or medical outcomes. The Choosing Wisely campaign has no anticipation to scientifically research its own efficacy, but academic centers and clinics are making plans to independently report on the impact of the campaign. Doctor analyzed many services listed as low value by Choosing Wisely and other sources and found that 25 to 42% of the Medicaid patients in the United States received at least one of these services in average year. The scope of Choosing Wisely recommendation for cancer care is not well defined. This quality movement improvement still characterize the scope of this recommendation, focusing on the de-implantation of low-value cancer care, identify potential challenges or different views for future work. There are more potential defects in Choosing Wisely initiative, perhaps the major, the lack of uniform metrics. It is feasible to state that the test is unnecessary, but what criteria are used to reliably and prospectively define what is necessary? The most important challenge will be the change of our attitude in clinical practice for the situation in which scientific evidence suggests that the proposed intervention has modest or no impact or could be harmful. Should be scientific evidence. The change is necessary, and this change is necessary, and the challenge should be accepted quickly, so that choosing wisely more and more will mean choosing right. It was reported that several important steps still remain to fulfill the promise, and choosing wisely is now time to take those steps. As we in the program adopted flexibility of thoughts and encourage brainstorming idea, we may suggest that the Choosing Wisely campaign adopts the notion of the win-win initiative, which belongs to all. It could be advocate for global collaboration partnership to conduct unlimited scientific exploration and of evidence and value-based and patient-centered innovative approaches. that the rest of different parties and scientific evidence would be considered. Hence, it would be a global scientific better value choosing wisely campaign with other many good initiatives. We'll present some examples today where all stakeholder cancer care in the real world would gain, particularly in cancer patients. Then the initiative Financial Toxicity Tumor Board. The fiscal distress or other or what it is financial toxicity in which patients experience challenge in paying for treatment are becoming dominant problems for patients with cancer globally. For that reason, the first Financial Toxicity Tumor Board was launched in September 2029 in the Leben Cancer Institute. This institute consists of more than 40 hospitals and 900 offices that provide more than 12 million encouraged per year. This is in North Carolina and South Carolina and in Georgia. This model is modeled on the concept of a conventional multidisciplinary tumor board with participation, but with participation not only with physicians, but nurses, financial counselor, nurse and navigator, social workers, administrator who meets monthly. They are focused on financial toxicity and financial worry and fear experienced by patients with cancer. As a result, they found that around 60 million of personal expenditure has been evaded for nearly 1,800 patients. It's very interesting. Common Sense Oncology is very interesting and very respectable objective. It's a group of international experts and distinguished oncologists published a proposal that the win-win consider with great appreciation. Its intention, Common Sense Oncology. Several distinguished colleagues, really, Richard Sullivan, Booth, Christopher Booth, Bishal, who presented a nice hint about it in the previous ASCO-GOIS webinar, David Cullen-Engrich, and many distinguished really colleagues, dear colleagues. It says that oncology needs a recalibrated approach that is more patient-centered and prioritize equitable cancer care. An approach that prioritizes patient needs with treatments that improve survival and quality of life. It promote informed decision making and ensures that the treatment are accessible to all patients. There is a reference for this. With appreciation to noble initiatives by distinguished experts and colleagues, understanding of the common goal of the all similar good initiative, we in the win-win, every effort should be done not to consider the issue as a challenge or balance between innovation and access to cancer care, or innovation between hype, what's called hype, and what we have. But science should work to implement and to make things more affordable. It is not against, but with the affordability. It should be used, how to use it intelligently with increased affordability. In the win-win movement, we see that there is a need for big and wide movement of innovation and implementing science of more focus to increase access and better value cancer center care, and for the people of good, all will win. It is feasible. We presented many examples, but there are ample place for a limited number of research and studies really by all. What we see is many examples published and in our previous courses and in the upcoming seminars also. Encouraging a portable, we didn't invent anything. This is published and evidence-based by many authors. We didn't invent anything. Encouraging futuristic approaches. An example of is genomic adjusted radiation dose. A new proposal to integrate genomics into radiation dosing decision. Hence, what's called GARD, based on framework, who could be the new model for personalizing radiotherapy prescription dose in clinical practice. Till present, as we all notice, radiotherapy drops behind the vast progress done in targeted agent in systemic cancer therapy. In our view, we see that in spite of these tests could be expensive and that surely need advanced technology. However, with well-planned inter-institutional and industrial cooperation, this could be more developed and used widely in the West. Hence, it could be after for would be with organized and focused north-south cooperation. This could be applied in the South. This is surely for future studies. Reducing the cost of health care entails care redesign. New England Journal of Medicine Catalyst Insight Council member discussed initiative for decreasing healthcare costs, such as healthcare transition and home-based care model. So healthcare the redesign and include many things. It's very really important. All the above recommendations and suggestions are important. But we see that according to the win-win notion, without focused scientific study and exploration and clinical research, most of the recommendation would remain plans or wishes or in conference application and initiatives, just initiatives. The win-win scientific initiative raised the warning sign that most, if not all, economic system will not cope well or will not cope at all with the skyrocketing rise of total cost of cancer care. Hence, there are increasing of upcoming collapse or failure to cope. So it needs cooperation with all. Many combined scientific work are needed, and there are already many examples in next fourth and fifth webinars for systemic therapy and after for radiotherapy. There are at least 5 webinars in our books and reference and everything. It's time to move. Final notes and reflections. It's time to move from choosing wisely to choosing right, or as Lister suggested, using wisely. Using and not choosing, with the increase or at least to keep the value of cancer care through clinical research. Within scientific win-win scenario, smart idea, and every effort should be paid to consider the interest of different stakeholders. Hence, all would win in the real world. Please allow me to share with you my brainstorming points for wide feedback and to be included in the upcoming panels and for your discussion now and after. We welcome all your feedback sent to us, and we include this in the by your name and affiliation, everything. We are open for all constructive criticism, comments, and suggestions. In our view, choosing wisely common sense oncology or recommendation committees, commission publication, or stratified resource guideline aimed at prioritization of treatment according to what could be afforded or what makes sense, or according to the survey for wise intervention, those are not strictly applied by the surveyed consultant themselves in their daily practice. Or that is what Professor Eduardo Gazar will present, and he will present after in CICICA study, and present today something about this. Important, very important. All that are surely very noble initiative, but on the other hand, many circumstances they could be considered as acceptance of situations that should be changed for the better of patient. Just acceptance of the situation. It is not more scientific and logic to first focus on scientific efforts on detecting a lot of already published alternative of treatment without compromising the outcome of patient, and to increase enormously all scientific efforts for innovative approaches, smart model, and win-win deals. Therefore, we in the win-win movement and in this GOIS program and our books are considering with appreciation the using wisely common sense oncology, financial toxicity tumor boards, and all similar very needed endeavors. Moreover, we are calling for enhancing proposal, initiative, constructive endeavor by collaboration, cooperation, coordination, and evidence-based and pragmatic approaches that consider wide feasibility in the real world. Otherwise, the affordability of cancer care, including the rich country and healthy country, will have increasing crisis now and in the future. Could you come together to conclusions that the goal of increase affordability better care is a very important thing, a very important issue. There are published and our work to solve it, not to speak about it. There are many talks about affordability, about the disparities, but what is our role as scientists, as doctors, as clinicians, as thinker, maybe, to change the game and not to just to complain all the time. You see in our previous programs and in the upcoming program, many examples, really evidence-based, and they can do a lot. Many evidence-based examples, and this open a way for a limited number of researches. There are published suggestions that whole burden of discussion. Some suggest this, and this is that the whole burden of discussion with patient about the cost of treatment should be upon the treating cancer care doctor. No, as a clinician and researcher, I see this is not fair. It is unfair. It is very hard to put everything on the shoulder of the treating doctor, or even cruel to discuss as a doctor with our patient that the cost of suggested for cancer care is high than he or she can afford. We choose wisely or follow, or that we will choose wisely or follow the sense. How can faced as a father or mother or wife, husband, telling that cancer care of their beloved person is not affordable to them, or to choose other less costly care without scientific evidence that is not less patient-centered outcome and value? This need a lot of scientific work, and it is feasible. Isn't better that we as cancer caregiver and scientific and medical communities do first an effort to finding this our role as much as we can, scientifically acceptable and published alternatives. There are many things published really without compromising the outcome of patient. Then we call our wisdom after and sense and not before. How some scientific work or presentation undermine understanding of global oncology to prioritize deliver radiotherapy in countries where there are no adequate facility according to the rate of expected survival of cancer. If he live long, that they can give him treatment and let him screaming. How could we recommend the treating oncologist is not to deliver palliative radiotherapy as soon as possible to cancer patient with severe pain of bone metastasis, for example, impending fracture, impending spinal cord, or medial compression, because he is very late? There are some suggestions like this. Because it is far, because no, do something, do one fraction, big fraction. There are many solutions. While there are many scientific approach at present, now is now to double or even triple the number of treated patients with existing radiotherapy facility in most of countries who haven't adequate number of service. It is published by many distinguished colleagues, and we include this in our books. We presented this before. We published this, and there are upcoming seminars also again about radiation oncology for longer term. But starting from now, to plan to increase expansion of delivering clinical oncology with different acceptable but scientific model in real world. We mean remarkable expansion and not too much noise. And festival, radiotherapy festival, awareness of radiotherapy for cancer, something for yearly 0 to 3 more departments or one center of excellence here and there. But for in the underserved region, in considerable part of the world, while what is needed is at least 10,000 clinical oncology service. This is short of that. Of this time, maybe and will increase. So it's not 1 or 2, 3, 4, 10 centers here and there, and charity by the year or international organization, and all this what is center of, but it's 1 or 2 or 10 center even. We don't claim that we have the completely perfect statement or complete truth. Science is perpetual searching wherever. So live recorded panel are organized as part of the program. We are open for all views. This could enrich science and the cause of cancer care. All feedbacks, addition, comments, advice, constructive, critics, and new suggestions are welcome. We don't claim at all that we have the full wisdom. We don't claim at all that we have the magic stick, but together we can do a lot. Via science. If you like to get a PDF copy of that slide, please feel free to send us. And thank you for cooperation, and please feel free to send us your feedback. Sorry. So we are going, as we say always, going forward hand in hand. And we are waiting for your now and after and continuously your contribution, your leadership, going forward hand in hand. Thank you all.